Jessie?
Yep, that's me.
Hi, my name's Juliet. I'm going to be your nurse today. How are you feeling?
I'm doing okay. A little bit nauseous in the mornings, but other than that, I'm pretty good.
That's normal. We can talk about some of your concerns when I come back in a little bit. For right now, I'm just going to have you provide a urine sample for me, and then I'll be back in a little bit, and we can go over the results.
Okay, sounds good to me.
So your doctor will be in to see you in a little bit, but first I'd like to just ask you a few screening questions that we go through with every woman on her first prenatal visit.
Okay.
So you're pregnant. How do you feel about the pregnancy?
I feel good. I wasn't expecting it, but I'm excited now.
Okay, great. It can be a lot, but we will be here to help you throughout the whole thing, and if you have any questions, we have more resources we can provide you as well. I have a list of questions here, so are you a smoker?
No, I'm not.
Okay, and do you drink any alcohol?
I used to have a couple of glasses of wine every night, but ever since I took the pregnancy test, I haven't had any.
Okay. And did either of your parents have a problem with alcohol or drug use?
My mom didn't really. My dad was an alcoholic, and I think that he kind of had some problems with drugs, but not that I'm really sure of.
Okay. And does your partner have any problems with drug or alcohol abuse?
Yeah, he does do a lot of drugs, but I really haven't talked to him in a while, and I don't want him to be a part of the pregnancy.
Okay. And in the past, have you ever had any problems with alcohol or any illegal substances?
Well, this is kind of what I was afraid of.
What does that mean?
Well, when I was 16 in high school, I was playing soccer and I tore my ACL, and I had surgery from that, and then they gave me oxycodone, I think it was, for the pain afterwards. And then I ran out and I felt like I needed some more, and my boyfriend at the time, my new boyfriend at the time, he said that he could find someone who had something a little bit better, and then that was heroin, and that's how it all started.
Okay. Thank you for being honest with me. I'm a little concerned just because heroin is an opioid drug, and it can have very serious effects on not only you, but your pregnancy as well. This is why it'll be very important you be as honest as you can with us moving forward. Have you used it during the pregnancy so far?
Yeah, I have actually. The last time I used it was yesterday. I tried to stop. I don't want to do it anymore. I just want to do what's best for the baby, but every time I try to stop, I just feel so sick and like I just can't stop.
Okay. So this is it is a really serious thing for the baby especially, but we do have options that can help you, especially during the pregnancy.
Okay. Yeah, anything that you can help me with, I'm open to, because like I said, I really just want to stop. I just can't do it by myself.
Okay. So we don't recommend stopping the use of opioids suddenly during pregnancy. It can lead to more serious complications of withdrawal on you and the baby. So two options are opioids called buprenorphine and methadone. So they're prescribed to you, so they're more controlled instead of you getting heroin from someone you don't know and you can't trust. So this will give us a controlled way to manage your pregnancy. They maintain, so you won't be experiencing any withdrawal symptoms, and it'll decrease the risk for complications during pregnancy and after pregnancy.
Okay, yeah, I'm open to anything. I just can't believe I let it get this bad. I just want to do the best for my baby. I even started nursing school, but I had to drop out before clinicals because I didn't want to take the drug test, so I feel like it's just ruined my whole life.
Okay. Well, I'm glad that you're so receptive to the change. I actually am doing a seminar later this week for women who are in similar situations to yours. It's about using drugs during pregnancy and how we can help prevent that and treat that. So I will give you a piece of paper letting you know the details, and I would really love to see you there. And I think I hear the doctor outside now, so I'll put a recommendation in for you to reach out to an addiction counselor as well, some other resources for you. Do you think you'll be able to make it Thursday?
Yeah, that would be great. Thank you.
Okay. Thank you. Hi, thank you all for coming today. My name is Juliet Stilley. I'm a nurse at a local pregnancy clinic, and I'm here to talk to you today about increasing abstinence from illicit drug use during pregnancy. And this is a Healthy People 2020 goal that we're still trying to achieve. So the objectives for today's presentation are to have the viewers demonstrate knowledge of Healthy People 2020 goal, Mother, Infant, Child Health 11.4, and demonstrate knowledge of the effects of maternal drug use on mother and fetus, and identify risk factors for illicit drug use in pregnancy, and lastly, identify preventative measures and management to reduce illicit drug use in pregnancy. So why was this Healthy People 2020 goal created? Rates of drug use in pregnant women have been increasing, and in the general population as a whole. And the negative effects on the mother and baby are huge. It's very detrimental to both. So a little bit more on drug use. Deaths from prescription painkiller overdoses among women have increased more than 400% since 1999. And pregnant women who use drugs usually begin to use the drugs prior to conception, so it's something that you want to educate on before a woman becomes pregnant. And the occurrence of neonatal abstinence syndrome, which is withdrawal in neonates, has increased by 300% from 2000 to 2009. This just shows how often women are using drugs during pregnancy and the effects that it will have on the baby. And in pregnant women who are addicted to illicit substances, they have a 22.5% rate of preterm birth. So that's quite significant. Commonly used drugs during pregnancy are, in general, really, heroin. It can be injected, smoked, or inhaled. It's the most commonly abused opioid due to its low cost compared to prescription opioids. And that can cross the placenta within 1 hour of ingestion, so very quickly. Other drugs that could be used are cocaine, hallucinogens, inhalants, methamphetamines, stimulants, tranquilizers, prescription opioids, marijuana, and ecstasy. So these are just the most common, but there's definitely other ones that can be used and can still have negative effects. So there was a research study published in 2015 that explored the typology of substance abuse in pregnant teenagers. So the study included 810 participants. They were all women between the ages of 12 and 17 who were pregnant at the time of the interview. So this was a survey, and it was self-reported. It was their drug use in the last 12 months, their drug use in the last 30 days, which would be during their pregnancy, their trimester of pregnancy, and then any psychosocial or socioeconomic factors that could have affected like why they use drugs in the first place or what correlates with the drug use. So they separated these participants into different classes. So class 1 was those who abstained from drug use during pregnancy, and that was 42.5% of the study group. Class 2 was classified as the drinkers, so they consumed alcohol in the last 12 months at the time of the interview. And so that was 37.4% of the participants, and in the last 30 days, 20.5% said they used alcohol or consumed alcohol. So that's a significant amount. And class 3 was cannabis and alcohol use. So 9.5% of the study participants said they used alcohol and cannabis in the last 12 months. In the last 30 days, though, they had high rates of cannabis use. They had 100% use of cannabis in the last 30 days and 30.9% for alcohol. So that was all during their pregnancy, which is quite significant as well. So class 4 was the polydrug users, and that consisted of the drugs that are listed above. 10.6% of the participants were part of this group, and that is 1 in 10 of the pregnant adolescents. So in the past 30 days, 50% consumed alcohol, 57% consumed cannabis, 10.46% used cocaine, 18.6% used hallucinogens, 16.3% used inhalants, 3.5% used methamphetamines, 13.9% used stimulants, 16.3% used tranquilizers, and 8.1% used ecstasy. So all of this shows that a lot of them were using this during pregnancy. So 1 in 10 of these pregnant teens are using these more hard drugs during the pregnancy, and they have more of an effect on the baby, which we'll talk about shortly. So what does drug use do to the mothers? Drug use in general, for anybody, offers an increased risk of overdose. It exposes them to infectious diseases, especially if they're injecting using IV drugs. That they can contract Hep B, Hep C, and HIV. There's many physiologic effects. I mean, you can have tooth decay. Your organs can decay just because of the poison that you're putting into your body, and you are in a long-term addictive state. So all you think about is that drug and getting more. Now, effects of illicit drug use on newborns it's very detrimental, and different drugs can have different effects. So it varies based on the drug, it varies based on the frequency, the amount, and the route that it's taken. So cocaine typically causes preterm birth, small for gestational age babies, microcephaly, poor feeding, diarrhea, hyperactivity, and irritability. Heroin can cause stillbirths, low birth weight, small for gestational age, meconium aspiration, microcephaly, tachypnea. They're at a 74-fold increased risk for SIDS, and it can also cause seizures and physical dependence when they're born. Marijuana can cause neonatal tremors, low birth weight, growth restriction, meconium staining, among other things. And methamphetamine can cause small for gestational age, preterm birth, abruptio of placenta, cleft lip and palate, delays in motor coordination, fine and gross, and perinatal mortality. So a lot of them you see the same things. You're seeing preterm birth, you're seeing that they're small for their gestational weeks. So many of them have the same effects that are really quite bad for the baby in the long run. So as mentioned, neonatal abstinence syndrome is a condition that occurs when a mother has exposed the newborn to the fetus to drugs, and then when they're born, they no longer have that supply of the drugs, so they go through their own withdrawal. So it's just a discontinuation of the substances that they received in utero. So the effects of NAS are extensive. They have poor feeding, vomiting and diarrhea, irritability, tremors that can have seizures, incessant crying, hyperactivity, nasal congestion, which can include like sneezing, tachypnea, and they also might have a fever and be sweating. So the Healthy People 2020 goal is measured using a survey. They do this annually, and it's a survey that includes women from 15 to 44 years old, so those that are in childbearing age. And they ask 4 main questions. So they ask how long it's been since you last used the specific illicit drug, and they'll ask that for every drug that they have on their list. How long has it been since you last used a specific prescribed drug that was not prescribed to you, or you used it for the feeling it caused? They also ask, are you currently pregnant, and how many months pregnant are you? And so when they collect this information, they use data from 2 years combined when they report the current year. And so if you look at this chart, it shows our progress, and it's not looking great. So we have remained relatively steady, but there's a downward trend. So we started just below, in 2003 it was just below 96%, and now it's just above 94%, so there's been a decline. So how do we fix this? One of the best ways is prevention, and this just has to do with mostly education, and this education should be done for anybody, I mean, it should start in middle school, really, when kids are starting to be exposed to drugs. And it's really important to just educate them on the effects of drugs in general. And then when they start to be, like the females of childbearing age, they should be even more so educated on the effects that it can have on their baby, because a lot of women who are pregnant are willing to change. It's just one of the times in their lives where they're most willing to make that like change in their life and stop using. So it's important to educate as soon as you can. Screening should be done at the first prenatal visit for every woman. The accuracy is high, and if they respond yes to any of the questions, it's important to gain more information, ask more questions, refer them where they need to be referred. So this is done, screenings are done with questionnaires, and they can also be done with urine toxicology screening. The questionnaires typically follow a pattern of the 4 Ps, so that includes parents, partner, past, and pregnancy. So parents, the question is, did either of your parents have a problem with alcohol or drugs? For partner, it's, does your partner have a problem with alcohol or drugs? In the past, it asks, have you ever had any beer or wine or liquor? In pregnancy, it asks, in the month before you know you were pregnant, how many cigarettes did you smoke? And in the month before you were pregnant, how much beer, wine, or liquor did you drink? And all of this is just assessing the risk factors for using during pregnancy. So in order to treat addiction and drug use during pregnancy, it kind of varies based on what they're using, so it's important to find that out. If they are addicted to opioids, such as heroin or prescription opioid medications, they should be put on a methadone maintenance therapy or buprenorphine. Most other illicit drugs, you should be using, abstinence is usually the best way to go. They can also be referred to Narcotics Anonymous, addiction counseling. You just want to be able to collaborate with other professionals. So abstinence from opioids causes complete acute opioid withdrawal, and this is not fatal to adults, but during pregnancy it can be detrimental to the baby. The acute opioid abstinence syndrome causes hypertension, tachycardia, preterm birth, placental abruption, poor fetal heart patterns, and ultimately it could cause fetal demise. So it's definitely not recommended for pregnancy if you are using opioids. So it's important to know what the patient is using. Methadone is a substitute for opioids. It was previously discussed. So this is a controlled and prescribed substance that you can receive at federally licensed facilities, at methadone clinics. There's a lot in the area that you can go to. It decreases perinatal risks compared to heroin. It prevents the mother from going into that acute opioid withdrawal syndrome. So they will start at 10 to 30 milligrams a day and increase it until they have no withdrawal symptoms. And they will titrate it back down after the pregnancy to wean the mother off so that she can abstain eventually. Buprenorphine is another option for opioid abuse. It's a semi-synthetic opioid, but there's less euphoria, less sedation, and a lower risk for respiratory depression than methadone. It transfers less to the fetus through the placenta, and in turn there's a reduced rate of preterm birth, longer gestation, and then that increases the birth weight, which is what we want. Thank you so much. I hope everyone learned a lot from this presentation, and if you have any questions, feel free to ask.
Hi, this is Jessie. I am 7.5 months pregnant today, and as part of my Narcotics Anonymous and my addiction treatment program, I am making a video diary entry. Not only am I 7.5 months pregnant today, but I am also 6 months clean from using illegal opioid drugs. After speaking to Nurse Juliet and attending her seminar on substance abuse and pregnancy, I knew it was time to make a change. So I spoke to my nurse, and she helped me make an appointment with a facility that was right for me. I met with a doctor and a psychologist and an addiction counselor there, and I was
prescribed buprenorphine to safely manage my withdrawal symptoms during pregnancy and to wean from using illegal opioids, which I have been doing. I learned a lot about the treatment options from Nurse Juliet's seminar, and I'm glad that I went. I'm also glad that I have the opportunity to take buprenorphine because promising research shows that it has better effects on the baby. My treatment team started me on buprenorphine 18 milligrams per day. Since then they've tapered me down to only 8 milligrams per day. I know that the buprenorphine still has negative effects on the baby, and that after I deliver, the baby will still probably have some NAS symptoms. And I also know that the ultimate goal after I deliver is for me to become completely sober from all opioid substances and all illegal substances, which I fully intend to do. In order to keep custody of my baby, I fully know that I'll be required to stay in my treatment program and attend regular Narcotics Anonymous meetings. I also know that my baby will probably have NAS symptoms, and that's something that will happen just because I have been on the buprenorphine. But I am glad to say that by being on buprenorphine, which is a controlled substance and not a substance that I just got off of the street somewhere, that I did reduce her risk of getting HIV and Hep B and Hep C from using dirty needles. So by not using dirty needles and from using a controlled substance that was regulated by the federal government, I reduced her risk of getting diseases like that. And I knew what I was putting in my body. It wasn't just something that could be laced with other things that I have no idea what they are. I think what contributed to my success the most was the 3-step approach that Nurse Juliet had when taking care of me. Nurse Juliet explained to me that her solution to the problem that I, as well as many other expectant mothers have, was early identification, followed by early intervention, followed by closely monitored maintenance therapy, being the methadone or buprenorphine. So identifying my problem so early was a key part in my success. We identified it at my very first prenatal visit, which was great. The longer I was taking heroin with who knows what else in it and using dirty needles, the more damage I was doing to my baby. I'm thankful that I was asked those preliminary screening questions because they helped me uncover my serious problem, and I don't know if I would have done it on my own without those questions. My nurse intervened as soon as she knew I had a problem, which was another factor that greatly contributed to my success. The earlier I started my treatment, the less my baby was exposed to. It's as simple as that. And lastly, my closely monitored maintenance therapy is what really carried me through to this point. It's important to have support and be closely monitored because it is hard to make this change when your body is really addicted to substances. But with the help and careful monitoring by my whole healthcare team, that's what helped me the most. Thank you, Nurse Juliet, for identifying this problem at my very first prenatal visit. Thank you for intervening as soon as you knew that there was a problem, and thank you for monitoring my progress throughout my whole treatment plan.